You as a GI doctor many times have a question. Such a thing as GI Lyme disease. Is such a thing exist?
In the 20 years that I've been practicing pediatric gastroenterology and nutrition, I've had the opportunity to biopsy over 100 children from the stomach, small intestines, and their colon. Initially, we sent the biopsies for a special silver stain by a Harvard pathologist who found the actual infection in their GI tract. We then followed that up with polymerase chain reaction testing on biopsies, where they looked for the outer surface protein A, which is specific for Lyme disease, and we found in over half of the cases that children actually had evidence of Lyme disease in their stomach, their intestines, and their colon.
What would be your approach if the diagnosis is made? What would you do?
It depends on when the diagnosis is made, how long it's been, and what their other symptoms are. But if they haven't been on antibiotics, they need to be treated with antibiotics.
The antibiotic of choice in an older child or adult is doxycycline, but a younger child would be amoxicillin?
Amoxicillin for anyone under 8. Doxycycline for over 8. The problem with doxycycline in the summer is there's a photosensitivity, and if you're on that medication, you might break out in a photosensitive rash.
And the tetracycline is always concerned with the teeth, and it becomes increased pressure to the head. Is that correct?
Right, but in kids over 8 years of age, that's less likely bone problems. They're usually are old enough to tolerate doxycycline. The other concern is now the ticks that are picking up Lyme disease are also picking up other infections from the deer called Bartonella, known as cat scratch fever, and also mycoplasma, and we've heard of mycoplasma in Gulf War syndrome, mycoplasma fermentans, mycoplasma penetrans. So you can get multiple infections from one tick.
And if you had mycoplasma, would doxycycline cover that?
Doxycycline covers all 3. Doxycycline covers Bartonella, mycoplasma, and Lyme.
But amoxicillin won't.
Amoxicillin would only cover Lyme, and it would not cover Bartonella or mycoplasma.